evening, everyone, and welcome to May's edition of the Ask Mary and Pat Show, featuring Ms. Mary Fenner and Ms. Pat Boga. We are so glad that you are joining us this evening from wherever you may be. And to those of you who will watch the recording later, thanks for tuning in. My name is Tabitha White. I am the Assistant Technology and Metrics Director for Oak Hill Regional Community Development Corporation, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Ms. Jennifer Garrett, our executive director, Dr. Michael O. Minor, and our project director, Ms. Lottie Minor. In addition to this Zoomcast, we are restreaming this evening's webinar on Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. Feel free to like and share on your social media pages. Also post any questions or comments in Zoom chat or in social media comments. We will do our very best to respond to each question. Before we get started, here are a few reminders. If you haven't downloaded the Oak Hill Regional CDC app, please take one moment to do so. It is free of charge, absolutely free of charge, on Google Play Store as well as the Apple App Store. Also, all you have to do is search Oak Hill Regional CDC or Mississippi Healthcare Help. Did I say again that it is free, absolutely free of charge, $0, 0 cents. Yes, you heard it correctly. Download it right now. Our next third Wednesday parent chat resource will be on June 21st, 2023. June is Men's Health Awareness Month, and our speaker will be Dr. Kent Key, PhD, from Michigan State University Division of Public Health. The next Ask Mary and Pat show will be June 26th at 6 o'clock p.m. sharp. We will remind you again at the conclusion of this show. Now, it's time to get started. Ms. Mary Fenner and Ms. Pat Boga, it's all in your hands.
Okay, good evening, everyone. I'm glad that you guys can join us today. And if you have any questions, as Ms. White had said earlier, you can put them in the Zoom chat if you're on Zoom, or you can go on social media and add your questions to social media. And we will try our best to get to your answers. If we can't answer you today, we will find an answer for you. I'm Mary Fenner, and I'm a navigator and a Medicaid assister with Oak Hill Regional Community Development Corporation. And our phone number is 662-298-3584. If you need any assistance with health insurance, or if you have any further questions that haven't been answered tonight.
Good evening. I am Ms. Pat Boga, and of course, I am a Medicaid assister as well as a navigator with Oak Hill Regional Community Development Corporation, and we're excited to be with you on tonight, and we are ready for your questions. And I believe we'll go to the first question. If I lose Mississippi Medicaid for my son, who is over the age of 19 now, what are my options for health insurance for him? Okay, now the answer to that question is if you or your son have qualifying income, you may be able to apply for insurance through the Affordable Health Care Act, through a special enrollment period. And if not, we can refer you to one of the federally qualified community health centers in your area. So yes, indeed, there are options for him to receive some kind of health insurance.
Okay, next question. Okay. I lost my Medicaid after I got a job, but my kids still receive it. My job's insurance is too expensive. Are there any other health insurances I can apply for? The answer is yes. You may be able to apply for insurance through the Affordable Care Act. You can give us a call at Oak Hill Regional or Oak Hill RCDC at 662-298-3584. And one of our sisters may be able to help you, or we can also refer you to a federally qualified health center in your area if you are not eligible for insurance through the Affordable Care Act.
Another question? Okay. My son is 12 and it's time for his chip to be renewed. My income has increased since last year. Is it possible that he will lose his chip coverage? I'm afraid my employment's insurance will be too expensive or open enrollment for me to enroll him in my employer's insurance may have passed or is not until the first of next year. Are there any other health insurances I can apply for? And yes, we've been talking about that. There are health insurances you can apply for. I would definitely check with my employer just to make sure that open enrollment is, hasn't passed, or, it may be coming up very soon, but check on that. But in the meantime, you may be eligible for insurance through the Affordable Care Act. And all you have to do is give us a call. That number is 662-298-3584. And one of our sisters can help you through the process. Okay?
Yes, and if it's important that your children and yourself have insurance, because
Yes.
insurance can help with you not having to go to the emergency room and get that real high bill. So prevention is better than you actually having to go through that, or emergency arrives and you have no other choice but to go to the emergency room. So if you can, if possible, you need to contact us so we can see if we can help you with getting insurance for you or your child.
Right, because actually that bill you will receive from the emergency room is going to be extremely high. And so just give us a call and we'll do everything that we can to assist you.
Okay. Next question. Okay. I just heard that Medicaid recipients no longer have to pay copays. Is that true? And the answer is yes, it is true. Effective May 1st, 2023, Medicaid has removed all copayments for prescriptions and health care in Mississippi Medicaid for Medicaid recipients. It is called the Mississippi State Plan. If you have paid a copay since that date, you may have to contact Mississippi Medicaid to get reimbursed. And there you will call your local office. And if they're not able to help you, then you can give the main Mississippi office in Jackson a call to get assistance.
Okay. Do we have another question? What do I do if I lost my Medicaid coverage in Mississippi during the Medicaid unwinding? Okay. Have no fear. You may still qualify for Medicaid if your income has lowered since you were denied, or your Medicaid closed because your income exceeded the limit. You can reapply, but you must meet the requirements. And those requirements are, you have to be a Mississippi resident, be a US citizen, and you must either U.S. citizen, a permanent resident, or legal resident of the United States, and you must need assistance with accessing health care, and your annual income before taxes are withheld must be below the limit for your household size. And also, you may also qualify for reasons other than income, okay? And that will be if you're pregnant, responsible for the care of a child who is 18 and under, age 65 and older, and meet certain criteria, be a person with a disability, or in need of nursing home care. And of course, there's also other insurance you may qualify for. Just give us a call at Oak Hill Regional Community Development Corporation to talk with a certified assister. You may qualify to apply for insurance through ACA, which is the Affordable Care Act. Okay, so make sure that you check some of the other sources out. And of course, if you're not eligible for the insurance, again, we want to let you know that you may qualify. Well, you can go to one of the federally qualified community health centers for service.
Okay, we will have a commercial break.
Okay.
There are Mississippians applying for health insurance that may not qualify for a program. However, we all know it is important for families to have health insurance. This is why Healthy Kids Mississippi has been working with our state's federally qualified community health centers, or FQCHC, to help our fellow citizens find a medical home. Our organization is focused on raising public awareness about health coverage options for children and their parents through the Medicaid and Children's Health Insurance Program, or CHIP, in the state of Mississippi. Our process is simple. Our organization's assisters seek out Mississippians. Once our assisters gather the necessary information from the consumer, they apply for insurance programs on behalf of them when consent is given. When the application process is complete, the applicant will find out by mail if their application has been approved. We want to help as many families in Mississippi as we can. To learn more about our organization, please visit us on our website, healthykidsms.org, or give us a call at 662-298-3584. We welcome you.
Thank you for the commercial. It was really informative, and I hope that helped you with deciding on what you can do or the different options you have with your health insurance. Okay, our next question. What if I no longer qualify for Medicaid? I need some kind of health insurance, and my job isn't offering it at this time to employees. Well, there's the Affordable Care Act, the marketplace health insurance, something that we have been talking about already, but it may be available and you may be able to find a plan for a reasonable premium depending on the plan you select and your income as well. With your income, you may be able to get assistance with your premium through the premium tax credit. And you might be eligible for a special enrollment period, which goes from March 31st all the way to July 31st. One of our navigators will be able to help you and talk with you and go over various plans with you with your written consent and help you get enrolled through healthcare.gov. So just give us a call at 662-298-3584 and ask for a navigator, and we can assist you with that. But you also might want to check with your employer to see if you can get insurance through your job. To be sure, if you or your child is a student in college, you may be able to get campus health plan. But but check with the school to see first. But always give us a call and we can help you further. We can lead you to the right direction. If you have further questions or if you need further understanding, we can help you to be able to understand further what are your options, the different options that you may have when it comes to health insurance.
And again, we want to encourage you to download our app. We're going to share more information on our new app. And there's a plethora of information there for you. So we want to make sure that you take the time, as we did, and download our new app, okay? And let me see. Okay, we have another question. I took my child to the doctor to find out while there that my child is no longer enrolled in Medicaid. I didn't receive a closure letter from Medicaid. So how did this happen? Well, one of the things is, I want to ask you a question. Now, did you have a change of address or phone number change during the public health emergency? Did you make sure that your Medicaid office had your correct or updated address in case you moved? Did you let them know that you had moved, or you had a change of address, or even your phone number? So often we call and numbers, they change quite often. During the public health emergency, well, after the end, they were contacting people, Medicaid was contacting people by phone, by text, by email, and also by letter. So one of the things that you really need to do is make sure that your address is updated. So now you can go ahead and reapply if you feel that your income is basically the same or within the guidelines, and you can do that. And but what you need to do with that, as far as your address and everything, you need to contact the Medicaid office and make sure that they have your correct address. And we hate to preach to you, but a lot of times, we get mail, and some of us have a special place, when we walk in the door, we take our mail and we put it in a certain place. And oftentimes we don't even open it and read it. So we just want to encourage you to just be on the lookout for any correspondence, because, it's very important. You don't want to miss out. Like this consumer did. We just want to make sure that you contact your Medicaid office, and if you feel that you're still eligible, or you can contact one of us, our Medicaid assistants, our applications administrators. We will be so delighted to take the time with your written consent or your verbal consent and sit down with you over the phone or what have you, and complete a Medicaid application with you and submit online. And then all you have to do is get your income in. Actually, you can get it to us and we can download your income, upload your income, and send it in with your application. And the normal procedure, of course, is within 30 days, you should receive a notice as to whether or not you still qualify or not for Medicaid or CHIP.
Also, if you have not heard anything from Medicaid at this time, they have sent out so much information.
Yes.
They're sent out postcards, they've done emails. If they have your email, I'm not sure if they've done phone calls, but I know they've done postcards. And so if you have not heard anything, then evidently they do not have your address on file. So this would be the perfect time while they're in the process of getting ready to start doing renewals,
Right.
to give them a call and make sure they have your correct contact information, especially if you have not received anything from Medicaid. Please give them a call. We can't emphasize enough about keeping in contact with Medicaid. Give them a call. Make sure they have your correct address on file so that they can process and your children or yourself will get renewed with Medicaid. Because some renewals are being done automatically. If they're able to get all the information that they need, they'll automatically do it. But if not, that might make it to a point where you might get put to the side because they can't get your information right now. They don't have the correct address for you. And more than likely, if they don't have the correct address for you, you're going to get cut off without any consideration for a renewal. So it's very important. They've been sending out emails and postcards about doing your updating your contact information. So please, please, please get in contact with Medicaid and let them know that you have a new address, I have a new phone number, I have a new email address, so that they can contact you, so you won't miss that opportunity to get yourself or your children renewed for Medicaid.
And if you need help with finding the number for your local Medicaid office, now we can help you with that too.
Yes. Yes. Okay, another question. I recently had my baby girl, and I was told when I got approved for pregnancy Medicaid that I myself would have coverage up to 2 months after the baby is born. I am experiencing some postpartum medical issues, and I really need to continue to see my doctor and receive services for more than 2 months. What do I do? My income is limited, and I have no other health insurance. Well, recently, the postpartum Medicaid has been extended from 2 months to 12 months. So if you've had a baby and you were told at the time of application that you were only going to be eligible for 2 months, now it's been extended to 12 months. So you should still be able to get that medical assistance that you need for yourself,
Right. And that's really, Ms. Finner, that's really important because, a lot of times, for instance, the baby may have, during the delivery, there may have been some kind of issues going on, or even after you have the baby. Normally, they have been giving you, of course, you get a 2 weeks exam, then you go back again for your 6 weeks exam. And then, in the past, after that, even if you're having some other kind of complications, after those 2 months are up, that's it. But now you get 12 months. So that is giving you more time, whatever those complications are. We just hope that, this period will give the doctors time to get everything corrected and taken care of.
Okay, now we have another commercial break.
Congratulations! You have successfully selected and enrolled in a marketplace plan. Choosing the right health plan can be overwhelming, but it is important for you to know that the next steps are just as critical as selecting the actual plan. This is why we created this video, to guide you through on how to get the most out of your health insurance coverage. When open enrollment ends, the period known as From Coverage to Care begins. It is an initiative championed by the Centers for Medicare and Medicaid Services, or CMS, to help consumers with new health care coverage understand their benefits and connect to primary care and the preventative services that are right for them so they can live long and healthy lives. Ask yourself questions like, is there a time when I thought I should go to the doctor but didn't? Was it because of the cost? Was I afraid of finding a problem and how much it would cost if I did? Well, finding out early is better for your health and your pockets. Having health coverage relieves the stress of finding and affording healthcare services when you are sick. It is important to familiarize yourself with common health insurance terms. Terms like premiums, co-payment, deductible, and others. This will help you understand the differences between health coverages. After you understand the terms, it is a good time to learn about the different financial assistance options that are available for you, like premium tax credits and cost-sharing reductions. Once you have a basic understanding of health coverage terms and options, it is important to log into your account with your new health insurer provider so that you are able to pay your monthly premium. In your account, you will also be able to view your policy benefits, activity and usage, your ID cards, and also the ability to participate in telehealth. It's important to know where to go for care. Find a DR before going to the ER. By logging into your account and searching for providers in your network, you will eliminate the hassle of going to an ER. Finding the right provider for you is essential in maintaining good overall health. You may want to visit a few offices to make sure you and your primary care provider are well suited. Be prepared for the visit by bringing ID cards, records of your key information, including medical conditions, dates of past surgeries, current medications, doctors' names and contact information, next of kin and contact information, and any drug allergies. During your visit, it is important to be open with your doctor. Asking questions is key to good communication with your doctor. If you don't ask questions, he or she may assume you already know the answer or that you don't want more information. Don't wait for the doctor to raise a specific question or subject. He or she may not know it's important to you. Be proactive. Ask questions when you don't know the meaning of a word, like aneurysm, hypertension, or infarct, or when instructions aren't clear. For example, does taking medicine with food mean before, during, or after a meal? Now that you have a general idea, it is important to remember to make sure you pay the monthly premium and also continue to make appointments and fill prescriptions. Here at Get Covered Mississippi, we are always ready to assist you. Please give us a call at 662-298-3584 or text us at 662-689-9712. Email us at info@getcoveredms.org or visit our website at www.getcoveredms.org.
And has been some valuable information right there. We've been talking about the affordable health care insurance basically all evening. And some of us, are afraid to reach out to something that is there for us. The Affordable Care Act insurance is there for us. And you would really be surprised you'd really be surprised as to how this insurance has helped so many people. So many people they provide some preventative healthcare services, and pre-existing conditions are covered, and it offers variety hospitalization, it's covered. And you would just really be surprised how good this insurance is. And you may have heard from someone that, now I've heard about that, I really don't want to get involved in that, because that's a political thing. But no, it's not. It's real. It's real. Okay. Finner, you want to take that one?
Okay. I lost my family's Medicaid and I really can't afford health insurance. Are there any other services available to assist us? You can give us a call and ask for a navigator at Oak Hill. Our number is 662-298-3584 and talk with someone regarding options with your health insurance. If you have qualifying income, then you'll be eligible for maybe a special enrollment period. If you've lost your job during a certain time, they give you up to so many months after you have lost your job to be eligible for a special enrollment period, or if you have moved to a different state, or if you have other issues, if you have lost your insurance on your job, they give you so many months. If you lost Medicaid, they give you so many months that you may be eligible for a special enrollment period in order to apply for the Affordable Care Act. Also, if you don't have qualifying income, that's where the federally qualified community health center comes into play. And we cannot emphasize enough about them, because a lot of people may think, oh, that's a clinic. I don't want to go to a clinic. You know, they don't have real doctors. Well, this is a federally qualified health center. It's not a clinic. They have real doctors there that's able to assist you. So if you need assistance, if you do not have insurance, or if you're in the process of getting insurance and insurance hasn't started yet, call them, make an appointment with them. That might be somebody that you might want to continue to go with after you have it, after you get insurance, because they are really qualified to help people. They have a lot of services that they offer as well, because some of them do vision, not only health, but they also do vision, and some of them do dental. So you can call and talk to them and see if they have the services that you need. So that is something really to look into. If you don't have a number or a place that you can call, or you don't know of a federally qualified community health center, you can give us a call. And we have people on our staff. That's what they do. They work directly with the federally community health centers, qualified health centers, and they can assist you with going to the right center for you, or the right area, or the one that's handling your special needs. I mean, if you have any type of needs, that medical needs that are not being taken care of, give us a call, because we do have people on staff that may be able to lead you in the right direction with prescriptions, you know, also with medications, with the right doctors, with referrals to various different type of specialties. We have somebody on staff that can really assist you with those type of things. So please give us a call. And we constantly saying the number, but we just want you to be able to write it down. If you miss it the first time, it's 662-298-3584. And you can ask to speak to one of the navigators, or if you want to talk to someone dealing with the federally qualified community health centers, you can also say, I want to talk with somebody that deals with those centers, and they will connect you right away with that person. Just give us a call. We have things that can assist in a lot of different ways, you know. And if we can't, we can try to refer you someplace where you can get the assistance that you need.
And we definitely don't want you to shy away from the services, because we have even in the past spoken to some that said that it was just too much of a hassle to, you know, go through I may not qualify, my income may not be high enough to qualify for affordable health care insurance, but give us a chance to help you. We'll go through the plans, and with your consent, we'll get your information, and we'll do all we can to assist you, but don't just assume, you know. Give us a chance to help you.
With that Affordable Care Act, as long as with Medicaid, you know, give us a call, and we can try to help you the best that we can with Medicaid. We can refer you to the right office. We can probably give you your caseworker's name so that you can call and ask to speak to your caseworker directly. Or if you know that you no longer have Medicaid, and we could put the application in for you with your consent, actually put the application in. So just give us a call, and I'm sure that we can find a way to help you.
Right. And of course, we don't want to, well, we'll do that a little bit later. We'll get her prepared. Ms. May Stigler, another one of our Medicaid applications administrators, she is on the call with us. So we won't put her on the spot right now, but we're going to give her an opportunity in just a little bit to add on to what we are saying, because we want you to get the complete understanding that we are here for you. Oak Hill Regional Community Development Corporation, okay, for your healthcare needs. And we have another question. My two children are on Medicaid now, and they are aged 20 and 21, and will be losing their Medicaid coverage soon because of the end of the COVID-19 public health emergency. Will their Medicaid end very soon or abruptly? I need time to try to get, now they didn't say that, but I just threw that in. I need time to try to get them insured through my job or elsewhere. Okay, now the Medicaid has up to 14 months, 12 to 14 months after the end of the public health emergency through the Medicaid unwinding to complete renewals and also close Medicaid cases of those that no longer qualify for Medicaid, okay? There is no definite date. We can't tell you that it's going to happen tomorrow or next week or even next month or the next month. But of course, we do know it's going to happen. But as I said earlier, have no fear, because you do have up to those 12 to 14 months. And if you, well, it's best to go ahead now and contact your employer to see if you qualify for health insurance on your job, but also go ahead and get with us, and we can just get things in order and prepare for you to get you covered, okay? You can talk to one of our navigators through Get Covered Mississippi at, and we keep giving you that number, 662-298-3584. And we're actually, we work 365 days a year, okay? So if you panic one Saturday, something goes wrong, you may get your letter Friday and then you just panic because, oh my goodness, and I haven't had, the office is closed. No, you give us a call and we will do what we can to assist you to try to get you enrolled by looking at the health insurance plans to see what is best for your children and what fits your finances as well. So we're available for you. So let's have no fear. There's something for you.
Okay, next question. Okay, can you tell me when Medicaid renewals started back? I haven't had to renew my children's Medicaid in over 2 years. Well, the COVID-19 public health emergency ended on March 31st, 2023. And it started at the beginning of COVID-19, well, not actually at the very beginning, but it started March 2020. So during that time, there were everybody who had Medicaid, they were on there. They took new applications, but they were not canceling anybody or closing any cases. If you already had Medicaid, you had it. So now once that has ended, they're in the process of renewing everybody that's had Medicaid. So it's going to take up to 12 to 14 months for them to start the renewal process. Anytime between now and a year from now, that's when, a year from March 31st, they're working on doing the Medicaid applications. There's no set time. We can't tell you that on such a date, your Medicaid going to be closed. People are getting renewal letters and some people are not. So if you have any questions or if you're concerned about that, you need to give your Medicaid office a call and ask to speak to your caseworker to see if your renewal has been sent out, if your renewal is going to be sent out, or how much more time you have before your case is closed. And that's really important because you depend on Medicaid with your medical needs. If you're on some type of medication or you need prescriptions and not only children, but adults as well. So you need to know when it's going to end, or you need to know what to do to keep it from ending. So it's important that you contact them. I know some people say, well, I don't want to bring it to any attention. They might close me now that I contact them. That's not the case. That is not the case. You need to contact them and find out as much information as you can. They have a lot of cases. So just because you contact them doesn't mean they're going to close your case right away. It's still a process. It's still a procedure that they have to go through. And maybe your case has not come up right now. So, but the best thing to do is contact your worker, see if the renewal letter has been sent out to you. The second thing you can do is give us a call. And if you feel like you're going to be, you haven't received your renewal letter and you feel like you should have, we can actually put the application in for you with your consent. We can put it in for you so that you can apply for Medicaid online, and then you would get some information from them once they received your application. Or if you feel like you no longer qualify for Medicaid, like the question before where the kids were 2021, so we know they're no longer eligible for Medicaid, but they may be eligible for the Affordable Care Act through a special enrollment period. It's important that you follow up on these type of things. Don't take anything for granted. I had Medicaid before and I know I can get it again. Please don't take that. Please follow up. It's important. It's important for yourself. It's important for your children.
Right. And once we take our commercial break, we're going to come back. I noticed in the chat, Mr. Campbell mentioned about no co-payments. That is great news, but we'll talk a little bit more about that when we come back.
CHIP has established itself as a critical piece of the federal state response to children's health care needs. CHIP, signed into law on August 5, 1997 by former President Bill Clinton, was created to build on the success of Medicaid by giving states the opportunity to receive enhanced federal matching funds to expand affordable health coverage to children and families that earn too much to qualify for Medicaid but too little to afford private health insurance. Over the past 25 years, CHIP and Medicaid have sharply reduced the rate of uninsured children in the U.S. Together, they have successfully kept children connected to health coverage and played an important role during recent economic downturns and public health emergencies in the state of Mississippi. The Children's Health Insurance Program provides insurance coverage for uninsured children up to age 19 whose family's income does not exceed 209% of federal poverty level. Families may earn up to 209% of the federal poverty level and be eligible for CHIP. A child must be determined ineligible for Medicaid before eligibility for CHIP can be considered. Children with current health insurance coverage at the time of application are not eligible for CHIP. Our organization, Oak Hill Regional Community Development Corporation, is focused on raising public awareness about health coverage options for children and their parents through our Healthy Kids Mississippi initiative. To learn more about our organization, visit us on our website, healthykidsms.org. Give us a call at 662-298-3584. or text us at 662-689-9712.
Now, we know by now, you have locked those numbers in. If you haven't, Ms. Finner, can we give it to them again?
Oh, yes, give it to them again.
662-298-3584, okay? And you can text 662-689-9712. All right, lock it in now. And as we saw in the comments about the no co-payments for Medicaid. Now that is awesome. That is awesome. Now that was just recently, we just received the information on that just earlier this month, effective May 1st, no Medicaid co-payments. Okay, and we've talked to people that you may, your child, or maybe you, there's some special medicines and medications that you have to take monthly. And a lot of times they're so expensive and you have co-pays. Don't worry about that now. No co-payments. Okay. And again, Ms. May Stigler, if you will open your mic, and if you have anything to add to what we've been talking about on tonight, we really would appreciate it to have that backup support. Good evening.
This is May Stigler. Ms. Boger and Ms. Finner has did an excellent job telling you that about Medicaid unwinding. Just make sure you check your mail for any information from Medicaid and make sure you respond to that.
Thank you so much. Thank you. Okay, Ms. Finner, do you have anything? I don't think we have any other questions. I don't see anything in the Q&A or in the chat.
No, I don't see anything else. No other questions or anything like that.
Also, this is May Stigler again. Also, I just wanted to make sure, and I know I heard y'all say it, but there is no co-payment for Medicaid at this time. Is that correct?
That's awesome.
That is correct.
That's awesome. Mm-hmm.
Yes. That is correct.
Yeah, because some people were going to the doctor's office and there was a copay at the doctor's office, or certain medications that they were getting, it was a copay with the medication. But right now, I mean, as of May 1st, there's no copay. And if you're still paying a copay, you need to contact your Medicaid office to find out what's going on.
And I mentioned medications, but it's for your health care as well, not just medications.
Right.
Okay. Well, unless the panel has anything they would like to add, or if they have any questions, we're going to take you back to Ms. Tabitha White, and we're going to get ready to close out.
We've come to the end of our Ask Mary and Pat show. You may learn more about us at www.oakhillregionalcdc.com and www.healthykidsms.org. Please contact our office at 662-298-3584 or text us at 662-689-9712. Once again, we acknowledge our board chair, Ms. Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. This has been a production of Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi.
Thank you.